Hey Texas Stride, I'm Monica and I'm an occupational therapy student, which means it's my job to help clients do any and all daily activities as simply and safely as possible. Low vision is a common complication of diabetes. It can be a result of diabetic retinopathy, where the blood vessels to the back of the eye get damaged, or from glaucoma, or even just standard age-related changes. But if we're having low vision, it can make it really difficult to do some of our self-management tasks like reading and taking medication, managing our glucometer, and even examining our feet. So I'm here to talk to you about some little changes you can make in your daily life to keep doing all those tasks simply and safely. Low vision can create a fall risk in your home. Something you can do if you do have stairs in your home is to mark the stair landings with bright colored tape to create a little bit more contrast if those are difficult for you to see. You will also always want to do your best to make sure your pathways for walking are clear of clutter. You might need to get up at night with type 2 diabetes to check a blood sugar or just go to the bathroom. So it's a good idea to make sure that your pathway is always well lit by keeping a night light, a flashlight, or just your phone nearby so that you can always make sure you have light. It may be helpful to draw your insulin ahead of time and store it in the fridge. For oral medications, you can mark the tops with a colored marker or with rubber bands or stickers to help better distinguish the bottles. You may also want to take your oral medications over a towel or a placemat of a different color so that you can see and feel any pills that you may drop. So it may be tough to see any small differences with our feet. So some good options would be to always ask a family or friend to take a look if you feel comfortable with that. If not, our phones are always a great tool because you can take a picture and then zoom in on what you see. You can take pictures of different parts of your feet, and then you have that tool. You could also get a long-handled mirror to help you be able to reach your foot and then magnify anything that is on there to help you see it better. So the test strip opening on the glucometer is pretty small, but to make it a little bit easier to see, you can either put a sticker, a piece of colored tape, or anything bright near that opening just to create a little bit more contrast and make it easier to see. You might also want to place your glucometer on a table when you're taking your blood glucose and bring your finger to the glucometer as opposed to trying to bring it to your finger. You can also use a magnifying glass or take a picture of your reading with your phone so that you can zoom in and make sure that you get an accurate reading. Also, you always want to make sure that you're wearing reading glasses or regular glasses if that is something that you need on a daily basis when you're taking your blood sugar. It's always good to play with your phone settings because you can make changes to help accommodate for your low vision. Here's how to make some of those changes with an iPhone. When you click Settings, you can change the brightness by sliding the bar up or down to make it more or less bright. You can also change the text size to make the font bigger or smaller. You can even make your text bold to help you see it better.